Welcome to the slideshow on why does lifestyle matter. We are in module 5 right now, and this one's all about reducing risk for chronic disease. The thing I would really like to say before we get started on this one is some of us already have chronic diseases. I know I personally have had one that I've been dealing with since I was in my 20s. And I know there's a lot of students that I've dealt with in the past that also have chronic diseases. So I want this to be an encouragement for you versus something that seems overwhelming. Because the good news is a lot of chronic diseases, there are ways to manage them and deal with them and make our bodies stronger and sometimes even to rid our bodies of them. But the good news is there are things to do to really help us. So that's my goal today, is if you're currently dealing with one, not to lose hope, and if you don't have one, of course, trying to prevent one from happening. So in the chapter, we talk about chronic disease and how it impacts our society, what factors increase your risk to get them, describing chronic diseases that are the leading causes of death in the US, and then really how our lifestyle can change the risk we have of them, and also just help us not to have specific ones happen as easily. So that's what we're going to be focusing on today. So keep in mind, at least 80% of heart disease, stroke, and type 2 diabetes deaths, and 40% of cancer deaths would be prevented if people did not smoke, they ate a healthier diet, and they exercised more. So to me, that's encouraging to think about the fact that, yes, that's a lot of people that are not surviving, but if you are staying tobacco free, if you're eating a healthy diet, and you're exercising more, which are things you do have control over, then that can really make a difference. So many of the health problems that we are facing now, obviously, um, come from the fact that people aren't taking good care of their bodies. So think about you. Like, what are some of the decisions that you're making each day that affect your overall health? So there's two different types of disease to think about for this slide. One of them's acute, and that's when you have something pop up quickly, like appendicitis, and it has a specific cause. It manifests very quickly, and often it can be cured and go away. Chronic diseases, however, develop usually over time. They can last for a very long duration, and in many cases, there isn't a cure for them unless the lifestyle drastically changes. And in some cases, even if lifestyle does change, they don't necessarily go away completely. So more than 75% could be prevented if the risk factors were eliminated. Most common and costly of health problems in the United States are from chronic disease. So keep in mind, worldwide, chronic disease is responsible for 80% of all deaths, with 85% of those occurring in developing countries. They cause 70% of deaths each year in the US. So I'm very much into visualizing, and for me to see, okay, that's 7 out of every 10 people die in the United States from something that was possibly preventable based on lifestyle. So again, those risk factors: unhealthy diet, physical inactivity, using tobacco products, and having excessive alcohol use. So just thinking about how, okay, if I can take those out of my life and take care of myself, even if I have a chronic disease, I'm going to really increase the health of my body. So another important thing to think about with chronic diseases is that a lot of times they go hand in hand with mental illness. The less we segregate the dimensions of our being, the more effectively we can work on prevention and care. So thinking about how, yes, it's physical, that might be what is being affected by the chronic illness, but it also impacts your mental. And that's just one of the other components of wellness that we've talked about in this class. So a person is more likely to develop a chronic disease if they have mental illness, and vice versa. So they unfortunately go hand in hand. So it's very costly to deal with a chronic disease. 90% of the 4.1 trillion annual medical care cost is for chronic physical and mental health conditions. Of the 3.3 million people who die each year in the US, approximately 70% die from a chronic disease. And prevention programs are a cost-effective way to reduce healthcare costs. So there are some things that we do in America to try to raise awareness. I know I was a middle school health teacher for 28 years, and part of my job, and even now as I'm teaching this class to you, is to help you understand the things that you can do and take care of yourself. So being educated, knowing that there's other groups out there and organizations that raise the risk um, level of understanding. So these just show some of those numbers to help you see, but of course, top of the list, heart disease and cancer, going all the way down to nephritis. So these are all things that can happen to humans. COVID-19 obviously really came in and caused some problems that didn't used to even exist. So obviously there are emerging things that occur too. So think of your risk factors, because these are the behaviors that lead to death or illness that otherwise could be preventable if a person did not engage in those risky behaviors. So tobacco use again, physical inactivity, not eating a proper diet, obesity, and just keeping in mind obesity is that high level of weight that you carry for the body frame size, going up to that 30% or more fat range. So keeping in mind that it's important to stay at a healthy weight. Lack of sleep, having high blood pressure, high blood cholesterol, and lack of diagnostic exams. And a lot of people don't realize they have high blood cholesterol or even high blood pressure if they're not getting tested. So I recommend, even at the age of 18, 19, 20, to still get things tested, especially blood cholesterol. When I was in my wellness class when I was 18, they actually had us get our cholesterol taken, and mine was actually 260, which is well above the healthy limit of how much cholesterol someone should have. And I was very active, worked out every day, thought I was eating healthy, and really found out that some of the oils I was eating back then from like popcorn and things were really high in saturated fats. And so once I was able to kind of be aware of it, I was able to make some changes. But even as a young adult, you can still have some of these things that are going on. So it's really important just to be getting them checked. So are you at risk? From the previous list, which risk factors do you personally have? And what are some ways you can decrease those risks from your life? And that's going to be a personal journey. We all have things in our life that can be very hard for us. Maybe we grew up in an environment that we just kind of did things because our parents did. But thinking about what things can you do, even if you kind of grew up in an environment that included them. And then why is decreasing this risk important to your wellness? So I'm not going to go into super deep detail, but obviously because heart disease is the number one killer, you want to do everything you can to keep those parts of your body healthy. And so blood vessels, obviously cholesterol and things from diet can really wreak havoc on them, causing them to narrow, especially from blockages. So trying to really do what you can to keep all of those areas safe. Obviously, there's other things that go towards having heart diseases. There's arrhythmias, there's different types of congenital things that people are born with. But just getting your yearly checkups and being tested is super important. I know that I get tested every year for heart disease because my dad died at the age of 47. And so I get tested, and so does my daughter and my son. They both get tested too. So they kind of break them down into many categories. Some of them are just not getting enough action in the heart. The muscle itself, because remember, is a muscle, becomes weaker, maybe from different diseases or things that a person has inherited or genetically taken on. It could be just that narrowing of the arteries, like we talked about. Strokes are when blood doesn't reach the brain. So it's similar to a heart attack, obviously, just not getting tissue supply for oxygen to the brain. Hypertension is blood pressure that's too high, and so getting that tested is super important. And then increasing the risk of other heart diseases can happen if you have hypertension. And then peripheral artery disease is when they're kind of checking to see if there's plaques and things outside of the main part of your heart and areas, but also like go into the extremities. And some people get plaque in the arteries as well. So that's important to get checked for as well. Cancers, pretty much anywhere that you have blood in your body, you can get cancer. So that's kind of an important thing to think about. They're named after their place of origin, but they can metastasize or spread to other body parts. So a tumor is an abnormal lump or mass of tissue, and biopsies are often conducted to determine if that tumor is benign or malignant. Keep in mind, a benign tumor is not cancerous and isn't usually a threat to health unless it's in an area that's causing problems in the body. Malignant tumors, of course, are cancerous and they continue to grow and invade the body, so they often have to be treated aggressively. Carcinogens are the items that we might be around, or substances that can cause cancerous growth, and it could be the area we live in, toxicity with the environment. It could be things like drugs, like using tobacco. So lots of things can go into play there. Non-smokers who live with a smoker have a 20 to 30% greater chance of developing lung cancer, and often cancers are treated with the use of chemotherapy, radiation, or through surgery. So as you're kind of looking across the slide right now, just noticing that, yes, these are just some of the types of cancers that are out there, and just being aware of them, that really the best thing you can do is be tested every year. And for instance, doing a breast exam just on your own. Males and females, any gender can get breast cancer as long as blood goes to that part of the body. So it's really not a bad idea even for males to check for lumps once a month and things like that. So really the best thing you can do is be finding early detection and looking at your skin for moles and things like that. Not being afraid of it, just being proactive. Another chronic disease that we see in our country is diabetes, and this involves that disruption of insulin, which is a hormone responsible for enabling the body's cells to use glucose from food for energy. So there are other complications from diabetes, like heart disease, kidney damage, blindness, and lower limb amputations. The best way to kind of know if someone's having signs to kind of look for is, are they excessively thirsty? Are they tired? Do they have unusual weight loss or blurred vision? Or just get frequent infections? So keep in mind, type 1 is more of a genetic one that 5 to 10 of total diabetes population have. Usually children are the ones that are diagnosed, and they can manage it through insulin injections or insulin pumps. Type 2 is more brought on by diet and lifestyle, and that's the one that we really kind of think of as the chronic disease portion that is preventable. So it can be eliminated simply, I'm not going to say simply, but it can be helped through diet and physical activity, which I know isn't always simple for people, but it can be super helpful. So the main things we want to do are think about, okay, there are other chronic infections out there, diseases, some of them like arthritis, inflammation of the joints, which cause pain, swelling, and stiffness, metabolic syndrome, which is a precursor to diabetes, osteoporosis, when bones become fragile, more likely to break, asthma, that inflammation to the airway and the lungs, chronic pain, when pain exceeds the normal time for healing, autoimmune disorders, which is when the immune system just over responds to the body and actually attacks itself. And then meningitis is a bacterial infection that causes inflammation in the membranes encasing the brain and the spinal cord. So just knowing that there are other ones out there to be aware of. So think about yourself. What are some ways you can be proactive? Because it can be kind of disheartening to read about this information or hear about it and feel like, oh, it's like bound to happen. Like someone is going to eventually get a chronic disease. But really, it does not have to be given in your life. It doesn't have to be a given. You can prevent it by developing a healthy lifestyle now, one that integrates mind-body wellness. So you can find wholeness through the different types of wellness categories and ways to take care of them, taking care for yourself, stopping tobacco use if it's taking place, limiting the alcohol and caffeine intake, participating in physical activity, maintaining a normal weight, getting enough sleep, finding ways to relax, and having just healthy relationships in your life, and try not to have many that are causing you pain. So ways to talk to your physician. If you are having one, let them know, like, hey, I'm having symptoms of this. These are the things I'm going through. What could be going on? What are some things I can do? And make sure you're working as a team versus trying to work about helping yourself by yourself. So think about the differences between disease care and healthcare. So you want to think about, okay, disease care is kind of like where you're just trying to treat the disease itself, and healthcare is more of I'm trying to do things to prevent further problems and I'm being proactive. Would moving to prevention focused medicine improve someone's whole body wellness? So thinking about how that could kind of shift how you're taking care of yourself. And how would you personally like to be treated? Do you want to be treated more as a let's just fight the disease once it's present, or okay, let's work more on preventing that disease and helping it so that it's not so invasive? So moving forward, plan now to choose to live a healthy lifestyle, commit to maintaining this lifestyle throughout your life, be positive. So much of our health is impacted by our thoughts. Help others around you to make healthy choices. Respect those with physical or mental chronic diseases. Let your knowledge reduce prejudice. Like some people I know, I've seen like think, oh, if someone's got diabetes, they probably just eat really poorly, so they deserve it. And that's not the case. In many, especially many circumstances, it could be just completely genetic. So not just causing that kind of prejudice against someone to happen. Be a policymaker, help us move from disease systems, treatments to more of a healthcare where we're preventing them. And then even if dealing with chronic disease, try to help your body by being positive and doing all the things you can to make it less impacting on your body. You can do this, and I hope that you make good choices, and I will see you in the next slides.